This portion of New Day Northwest is sponsored by Waterman Rhinoplasty.
Welcome back, everybody. Rhinoplasty, which is surgery on the nose, is one of the most exacting procedures involving the face, and that means you really want a surgeon who knows what he or she is doing. Please welcome Dr. Eric Waterman from Waterman Rhinoplasty and one of his patients, Becky Karine. Welcome, both of you.
Thank you.
How are you?
Doing
So
great.
tell me a bit about your practice and your background.
Well, I was trained in ear, nose, and throat surgery, also known as otolaryngology. There's basically two groups of doctors who do rhinoplasty surgeon. One are ear, nose, and throat surgeons. The other is general plastic surgeons. We kind of come from different angles. And the advantage of being an ear, nose, and throat surgeon is we're really concerned with the function as well as the form of the nose. You know, you can do a beautiful rhinoplasty, but if you can't breathe through your nose, it's a disaster.
That's a bummer. So you do the kind of surgery on people's deviated septums?
Right. I do a lot of
sorts
deviated
things.
septum surgery, reconstruction after trauma and injury, and that's kind of really what got me interested in rhinoplasty to begin with, is doing a lot of functional nasal surgery and then getting really involved with the nuances of the cosmetic part of it.
And you can make a beautiful nose that functions perfectly.
That's right.
Becky, what brought you to Dr. Waterman?
Oh, yeah.
Here just recently.
Just recently, I had decided that I wanted to go forward with a rhinoplasty, and I sought out Dr. Waterman because we had met previously before, and he did a wonderful job.
Your nose looks great.
Thank you.
What did you want done? What were you changing?
I was changing like the dorsal hump on my nose mostly, and then he also brought up the tip of my nose as well. And he did a wonderful job. I can tell Dr. Waterman's just very passionate about what he does, and I would recommend it to friends and family.
You look terrific. Let's see a before and after picture so we can see a little bit about what's going on. So it's, see, that's super subtle, but the tip of your nose is raised just a little bit, and it's perfectly straight. You were really happy with this, correct?
Oh, yeah, absolutely.
And
Very
functionally,
happy.
everything was good?
Yes.
But in fact, you were a patient of Dr. Waterman's years ago as well.
I was, yes. I originally met Dr. Waterman as a young girl. I went to my pediatrician. My face was very swollen. I was very sick. They couldn't figure out what was going on, so I ended up getting, you can see on the screen, I was, very swollen face. Yeah. But kept going back to my pediatrician, and I ended up getting recommended to Dr. Waterman. And
did you think you had a sinus infection? Did
yeah.
your parents think it was something like that?
They thought it was sinus infection. We thought I got antibiotics. We thought they also had this theory that I had just gotten braces. Maybe I had a reaction to my braces. So I kind of bounced around a little bit. Came to Dr. Waterman. He's the one who got the pathology report after getting a biopsy, and ended up getting sent to Children's thanks to Dr. Waterman. Got on the right path to chemotherapy. And
what was wrong? What did he discover?
oh yes, I had leukemia.
Oh my gosh.
Yes, yes. So that was.
I mean, that just really speaks to me about how if you've got some chronic thing going on, that you really do need to see a specialist and get to the bottom of it.
Yeah. She was a very interesting case, and I remember it was 15 years ago, but
she was just a little kid. You were like 10.
10 years old,
10
yeah.
years old.
And I see a lot of patients with nasal and sinus problems, including children. And her mother brought her in, and one of the challenges of dealing with kids is you have to deal with parents, including mothers, protective mothers, overly protective mothers. And one of our jobs is really to calm them and reassure them. But she came in, and her mom had this sixth sense, because I was the fourth doctor she had seen. I said something, there's something really wrong here with my child. And when a mother kind of is looking at you like that, knows her child, and then I saw that, when I looked at her face, I was like, that's not normal for a child to have a chronic sinus infection, have this kind of diffuse facial swelling. So I took her to the operating room pretty promptly, and we don't do a lot of sinus surgery in young children, but I took her in pretty quickly, and when I was in there surgically, I just remember, it's like, this is either a very, very unusual infection or something bad. So we biopsied the tissue, and it turned out to be, and I got a call from the pathologist, and they said, that's an acute leukemic infiltrate. So very unusual presentation for leukemia. And and so I just...
That must have been scary.
Oh yeah, very scary. But once I was at Children's and got treatment, I was inspired to become a nurse, and I'm a nurse today.
That is amazing. Congratulations. That's wonderful. And so when you wanted surgery on your nose, you come back to the guy who was the one who knew what was going on.
Oh, yeah.
You know, there are lots of kids who get colds, flu, this kind of thing this time of year. And I'm just thinking now that you've brought this up, how long should something like that last? And when do you kind of push past the, oh, don't worry about it, it's just a sinus infection, to get specialized help?
Well, you know, the typical viral infection, you know, we talk about it getting better after 5 days and being gone by 10 days. So a lot of people come in and, you know, see their doctor at a week, and, you know, they don't need to be on antibiotics. It's not necessarily a sinus infection. And then if it responds to antibiotics, if it lasts longer than that, then that's fine. Primary care doctors can treat that. But if you're getting recurrent infections occurring several times a year, or one that's not clearing after 2 or 3 courses of antibiotics, that's when you really need to see specialty care.
Okay, that's good advice as we head into this. What was your recovery time like on this most recent surgery?
Yes, most recently, recovery went really well, really smoothly. I took, I think, a week off of work, and I was back to work after not too long. Yeah. It was like a week and a half, maybe. I have a pretty flexible schedule being a nurse. So.
Is she super healthy, or is that normal
She's healthy,
to recover quickly?
You know, that's pretty typical of rhinoplasty patients in general. You know, a lot of them tend to be young, healthy women.
Right.
And so it's nice they recover quickly, and you know, it really is about a week. A few little stitches at the base of the nose, a little cast on the top, maybe a little bruising. And I tell people mostly, you know, a week out of work, if you're doing something like what you do for a living, I mean, might take a couple of weeks until bruising goes down. But other than that, most people can go back to their workplace in a week.
That's awesome. Well, thank you very much, and congratulations on your good health and your wonderful career helping other people get better too. Thank you both so much. Yes, you may applaud. I see people, they're ready. So I don't want to get in your way. To get in contact with Dr. Waterman and his team, please visit watermanrhinoplasty.com. We'll also put more information on New Day's website. That's pretty cool. Up next, why all kinds of people are discovering the joys of a walk-in bathtub. We'll tell you more about that in a moment.